that you've been recently diagnosed with asthma?
Yes, I have been.
Okay, so I just wanted to get a feel for your understanding of what asthma is and how we treat it. Is that okay with you?
Oh, that's fine.
All right. So asthma is the result of multiple factors. Some of them are environmental, so allergens can trigger this response in some people. Heavy fragrance can promote this response. It's really about learning what triggers your symptoms and how to manage that. Okay, so part of the trigger is when you're triggered. Okay, we call that an antigen. Your body recognizes that as something that should not be there, and it reacts accordingly. So in the case of asthma, your body is recognizing some foreign substance and causing inflammation to occur within the lungs. So the inflammation that's occurring is mediated by a lot of different things, but what happens is the bronchioles constrict, and you can't get air in and out, which causes the shortness of breath. The other thing that happens is the ability for you to clear your secretions is impacted. So you'll end up with a dry cough during an attack. One of the things I did want to make sure that I went over with you is an asthma attack immediately as you're being assaulted by something. So say you walk outside and you're running into pollen, and that's a trigger for you, and you immediately have shortness of breath. That's an acute asthmatic response, or an acute asthma attack, okay? But you can also have a delayed asthma attack, which is 4 hours or more after the exposure. You can then start to develop symptoms where you didn't have them before. So just keep that in mind, okay? So we've gone through some of the symptoms, which would be shortness of breath, cough, dry cough, wheezing, prolonged expiration, an increased respiratory rate, and an increased heart rate. So all of that is being caused by all the inflammation that goes on in your lungs, and the more that you leave this sort of untreated, the more damage, permanent damage, can occur in the lungs. Some scarring happens every time there's some inflammation, so it's really something that we need to manage. And so to manage the symptoms, we use things like short-acting beta agonists, which are things like, I'm sure you've heard of albuterol before.
Yeah.
Albuterol acts quickly to relax the smooth muscle in the lungs and open up those airways, okay? In addition to that, we can use inhaled corticosteroids. That would be something like an Advair disc. I'm sure you see them on TV. They're the purple discs. They act to reduce the inflammation within the lungs itself. So that helps to decrease the immune system's response to the antigen in the lungs, okay? There's also long-acting beta agonists, which is useful for treating people who are known to have late response to antigen asthma attacks. We can also use oral steroids if you're having an acute attack. A lot of people tend to get acute attacks after getting sick or when they're sick. So we can use corticosteroids to help with that as well. Do you have any questions with anything that we've gone over so far?
No, I think you're explaining it quite well.
Okay, so the plan for you is going to be albuterol, which is just used as needed. So if you feel shortness of breath and tightness, you're going to give yourself 2 puffs of that. That should help to relax that muscle and make it more easy for you to breathe. Do you have any questions about that?
No.
All right. Well, thank you so much for talking to me today.
Well, thank you.